Hello and welcome to yet another episode of Hair Talks by Terra Medical. My name is Dr. Joshua Chong and today we're going to discuss a topic that's not very commonly seen anymore because wide FUT or linear strip excision scars don't really exist anymore since people start to do a much better job out of it, and FUE has taken over as the more popular choice of explanting the hairs that are required for a hair transplant. Recently, what we've done is we've repaired a linear strip excision that was pretty wide around certain areas, measuring 4mm. Anything more than 3mm we'll consider a wide scar, and this patient is limited in his options when he's cutting his hair short across the back. Therefore, he requested that we put some FUE grafts into his linear scar, and he was assessed to be suitable. Not everyone is. So if your linear scar was actually keloidal in nature or had very poor skin integrity, will tell you that this is better done by a scar revision, actually cutting out the scar again and then trichophytically closing the ends of the scar. Now, however, this patient had good skin quality within the scar, and it was decided that we would actually transplant grafts from his remainder donor area, just a couple of hundred, into the linear scar area that prevented him from cutting his hair in the fashion that he wanted it to. And we're expecting at least a 75 to 80% graft survival. We actually made sites using a tiny FUE punch, much smaller in diameter, and then placing the grafts within the FUE punch sites at a density of about 35 or so. Usually I do not go higher than that in the donor correction because it provides enough coverage. So if you had trouble styling your hair with a really short hairstyle around the back due to a previous linear strip excision surgery for hair transplant, you can actually speak to us about having it corrected either via scar excision or via FUE hair transplantation into the scar. And finally, if someone still feels that there's still some visibility of empty areas across the area that they want to cut really short, SMP or scalp micropigmentation can be used to augment the coverage effect. So some might ask, where do I go to get this kind of surgery done? It's best to speak to a clinic with experience in doing such a surgery because there are many considerations to take note of, such as assessing the skin for its good integrity to ensure good graft survival, and also the implications of having the donor and the recipient across the same area across the back, how you're going to have to sleep for the next few days, and how you're going to have to clean that area to prevent any infection.